And they can use, in some cases, they can use these same sites that are provided for the patients to educate themselves. But there was a study done that if a specialist, if all he or she did every day was read all of the new literature on their specialty, at the end of the day, they would be 8 articles behind. And so if you think of this information explosion, you say, how do we manage that in every other sector of our economy? And the way we do that is we use sophisticated information systems. I mean, the best example is if you go to a trader and you ask that trader, you take away his or her Bloomberg, they'll say, I can't possibly trade without Bloomberg. And yet, and what do they get? And they'll tell you why. They get everything they need to know about the stock, about the market, about everything that could impact that stock. So imagine Bloomberg for patients that a physician was looking at, where he or she knew everything about the patient, where they knew everything about their diagnosis, all the latest information, and everything about the medication. And if all of that was pushed to the patient, drawn from some of these very sophisticated sites, and it was pushed also to the physician, then they could make a better informed decision, both from a quality and a cost standpoint. And the best example is they were doing an interview with someone about Bloomberg, and they said, we couldn't operate without Bloomberg because this is really important. We're dealing with people's money. And so if you think about that and you say, well, what about that health thing? That's actually important too, but we don't have the same standards for that.